Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Hearing loss that occurs gradually as you age, it sort of sneaks up on you. Well, it's pretty common. About 25% of people in the United States between the ages of 55 and 64 have some degree of hearing loss. And for those over the age of 65, it's even worse. The number of people with some hearing loss is almost 50%.
New advances in treatment options, including improved hearing aids and cochlear implant devices, mean treatment is available for most people. Here to talk about hearing loss and how it can be treated is Dr. Gayla Poling. Dr. Poling is the Director of Diagnostic Audiology at Mayo Clinic. Welcome to the program, Dr. Poling.
Thank you for having me.
Dr. Poling, good to have you with us. So, almost half of people age 65 have some hearing loss. How do you explain it? Do our ears just sort of wear out?
Well, it's a combination of factors. Some of it's just wear and tear. Our ears never take a break. You think about they're on 24 hours a day, 7 days a week for our entire life. There's not a lot of time to relax there.
No downtime for your ears.
No downtime for your ears. We also have very noisy lifestyles, so there's lots of exposures throughout our day and throughout our lifetime that can combine over time to contribute to that change that we're seeing.
Like eyesight with cataracts, if you live long enough, pretty much everybody gets cataracts. If you live long enough, does everybody experience hearing loss?
That's our current understanding, that age-related hearing loss occurs for everybody. Now, there are certain factors that could accelerate that for some over others. Certainly, our genetic makeup might make a difference in that.
So if your parents had difficulty hearing as they aged, you're more likely?
There's some evidence that suggests that. We're still just starting to scratch the surface on our understanding there, but certainly if you have age-related hearing loss in the family, it's something to mention and get a baseline evaluation.
There's being able to hear is actually a pretty complicated process, isn't it? I mean, there's a lot of different things inside the ear that allow you to hear, and then there's the nerve and the brain. And can you quickly describe how it is that something comes into our ear canal and we can actually hear it?
Sure. Sound just comes in out in the environment into our outer ear, in through our middle ear, and into our inner ear. Once it's in our inner ear or cochlea, that sound is then transmitted through the auditory nerve up to the brain, and we process that sound. So how we actually hear and comprehend that sound is a very complex system, and several parts of that system can be something that we look at in an evaluation.
So that would suggest that there are different types of hearing loss.
Correct. There's basically two big categories. There's a more permanent hearing loss or sensorineural hearing loss. That implies that there's something wrong with the inner hair cells inside the cochlea or something beyond that process. And there's also a conductive hearing loss. That means something is in the way blocking that sound or not transmitting that sound prior to that point.
And most people who have age-related hearing loss, which type do they have?
It's more the sensorineural or the permanent hearing loss.
And I know that often associated with this, I can tell you by personal experience, is that ringing in the ears goes along with hearing loss. Why does that happen? And is there, you see all the ads on TV that there are lots of options, or there are certain things that you can take that will solve that problem of tinnitus or ringing in the ears. Nothing works, does it?
Right. Tinnitus or ringing in the ears is something that a lot of us experience at least one time in our life, but some of it sticks and stays, and that's the kind of tinnitus that you're talking about. We do think it's related to noise-induced hearing loss or some sort of age-related hearing loss, some sort of damage to the inner ear is the majority of it. Now, there's some forms of tinnitus that we just don't know what the cause is. And for the most part, if it's occurring in both ears and kind of staying and non-bothersome, it's something that we generally don't have a regular solution for, and there's no cure for it. So there's no magic pill, despite a lot of the claims.
What you hear on TV.
Yeah, not currently.
And quite often when we have guests in, we always want to talk about risk factors for whatever the condition is that we're here to talk about. And for hearing loss, though, risk factors, that's kind of a different problem, because all that you can do is try to, ward off the hearing loss. But
Right.
What are some risk factors?
Yeah, certainly the best approach is always going to be preventing the hearing loss from even happening. So prevention is something we spend a lot of time talking about. So avoiding those loud noise exposures, whether they be recreational at home or whether they be occupational, really if you can limit that, that's going to help long term. Also, aging, just in general, everyone ages sort of differently. As we know, aging is a very complex process, and hearing is just one piece of the larger picture. So your overall health does impact your hearing, and that's an area that we're starting to learn more about as well.
If you're talking about your tinnitus, how long have you experienced that?
Years.
Wow.
And it sort of tends to get worse as your hearing gets worse. The two seem to be associated, but fortunately, if you think about it, you say, "Oh yeah, it's there." But fortunately, most of the time you don't even. It's sort of in the background. You
Great.
can't. Yeah. So that's a good thing.
And that's what we find out for a lot of people. The less focus that you put on it, the less bothersome it is. So if you're in a very quiet room, you're going to focus on it more.
So the things that you mentioned with regard to risk factors, one would be a family history, and another would be loud noise. How do you know what's too loud?
How do you know? That's a great question. It's not only just too loud, it's how long you're going to be around it. So we always counsel people on a combination of how loud and for how long. Generally speaking, if it's 85 decibels or higher or above, that's something you want to limit exposure to. So you don't want to be around 85 decibels for more than 8 hours.
And what
85
is
decibels.
what is 85 decibels?
That's a perfect next question. Normal conversation is around 50 decibels or dB. So when you think about 85, that is a little bit louder than that. Nice, easy ways to tell what that is. There's lots of different apps on iPhones or any kind of cell phone. There's sound level meters that are out there that can kind of give you a gauge of what is too loud.
Wow. So 85 is a max for how many hours?
For about 8 hours.
Oh my goodness.
And that aligns with what our current understanding is for increased risk just for constant exposure.
You mentioned your tinnitus. I have to say that once when I was in to get my ears checked, after the test was done, the audiologist said, "Did you grow up on a farm?" And I went, "How in the world can you tell that?" Because I did grow up on a farm, working on the farm, but how could an audiologist tell that from a hearing test?
Well, I can tell you have farmer's ears. Just look here. They didn't have those headphones on.
All the potatoes growing out of them? Uh-huh.
Your ears are pretty revealing. They're actually noise exposure exhibits a certain pattern on our hearing tests and our evaluation. So we can tell that certain amounts of noise exposure will reflect in a certain pattern on your audiogram.
On the audiogram, you can make a pretty accurate assessment with regard to what type of hearing loss it is, correct?
Correct.
And you use that as a basis for recommending treatment.
Or
Is there-
further evaluation.
Yeah, is there treatment available for every kind of hearing loss?
Well, it's a good question. The treatments are constantly being improved. There are definitely management options for every type of hearing loss. Actual cures or reversals of the hearing loss don't technically exist right now. So at least for the permanent types of hearing loss. So a conductive hearing loss, like we talked about before, might have a medical or surgical approach to that.
And you hear it all the time. Some people with age-related hearing loss, seem to do okay with hearing aids, that they seem to work for them. Other people say, I tried them, they didn't help me.
Right. And that's what's so fascinating about hearing in general. We can have two audiograms that look identical on paper and have two different outcomes for an individual. So there's so many factors in what goes into management options or treatment options for an individual. What kind of, if I'm sitting in a quiet environment all day, I might have different communication needs than somebody who's actively going to a conference and talking in loud meetings.
All right, hearing expert Dr. Gayla Poling. We need to take a short break. When we come back, we'll talk a lot more about hearing loss, and I want to hear a lot more about those hearing aids. Which ones work, which ones don't, and why they don't work if they don't.
And we need to talk some more about prevention, too. That's the main key.
Right. Plus, myth or matter of fact.
Hearing loss can affect your overall health. Is that a myth or is that a fact?
You're listening to Mayo Clinic Radio on the Mayo Clinic News Network. Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
We are back talking about hearing loss with a hearing loss specialist, Dr. Gayla Poling, who is director of the Diagnostic Audiology Clinic at Mayo Clinic in Rochester. So, Dr. Poling, myth or matter of fact?
Hearing loss can affect your overall health. Is that a myth or a fact?
It is a fact, but it's a loaded fact.
All right, explain.
Well, there's just a lot of information coming out right now and a lot of different research coming out to find out exactly how much hearing loss impacts your overall health. So we know from years of experience so far that hearing loss can result in social isolation or depression and really having individuals withdraw from communication, but really getting into the specifics about other comorbidities or, for example, diabetes, other health-related general health approaches are really what we're trying to get into now. How does hearing impact your overall day-to-day life?
So I want to ask you about hearing aids. I mean, the miniaturization with so many technical things has been absolutely incredible. I mean, look at the phone you have in your pocket or your purse. Isn't there? You sort of wonder, why isn't there something that you can stick in your ear that's so small that nobody can see it, that'll actually allow you to hear better?
That's the age-old question, right? There are a lot of new advancements in the technology for hearing aids and other amplification devices. The challenge is that those devices don't necessarily correct the damage that's done. They compensate for them. So they don't replace or regenerate those hair cells where the damage actually is. So even when we increase and have opportunities to hear those sounds, there might not be perfect hearing. It doesn't necessarily correct that.
Does it just increase the volume, or what? How do hearing aids actually work? And what's the difference between a conventional and then do you hear about, are they called digital hearing aids, right?
Yeah, pretty much all the hearing aids we have now are digital hearing aids.
So what does that mean?
What that means is that there's a digital processor in the hearing aid itself. So that sound that's coming in can be processed a lot more efficiently and to a lot, depending on the needs of the environment, more complexly.
So if you worked around a tractor a lot when you were younger, it would specifically work in that area to help make that part better.
Right. So
Wow.
it doesn't just make everything louder. It makes where you need it to be louder. And it also helps in really noisy environments. That doesn't mean it's easy to hear in those noisy environments, but it helps increase the signal to the noise in the background.
So what percent of patients with age-related hearing loss do you think can be helped by hearing aids?
That's a good question. I don't know the answer to that. There isn't a magic number. The majority of patients that we do see that qualify for hearing aids do get some benefit from them. Some get more than others.
And they're not cheap, though,
They
right?
are
The
not
digital
cheap.
ones, how much?
Again, I don't know a specific number that I can
mean, it's
throw out,
thousands,
but it
though,
is
isn't it?
thousands of dollars.
You need to put them
typically.
on your Christmas list, Shives. I know quite a few people younger than you that have hearing aids, and I am shocked at how small they are.
Yeah, they're
Quite
getting
impressive.
smaller and smaller every day. And it just depends on your communication needs and where your hearing loss is. So that's why when I look at a friend and I see the hearing that they have, I might not be the same match for that.
You were talking about the damage to the hairs inside the ear, and we always would love it if we could regrow or regenerate that process. Is there any research being done with stem cells and all of that kind of thing that we hear that might help that someday?
Sure, there's a lot of fascinating research going on, and some of the research is going on within the Mayo Clinic system as well. Most of this is not translated to humans yet. Most of the research that is cutting edge that we're seeing in the clinic are more pharmaceutical interventions to help or prevent hearing loss. So something you might take prior to noise exposure, something you might take in combination with a medication that you're on, such as like chemotherapy or something that you're going to be exposed to where it might cause hearing loss.
So you mentioned a couple of things about prevention, and obviously one of them is to avoid loud noises. 85 decibels for 8 hours is really bad. What are some other things that people ought to do to prevent this when they get older?
Well, a lot of the evidence that's coming out now is just general overall better healthy living is actually contributing to better hearing long-term or prevention of hearing loss long-term.
You mean like eating right and exercising?
Yeah, all the
and
things that make everything better for all of us.
It's good for your hearing.
It's good for your hearing too. Just
Wow.
another reason to live a healthy lifestyle.
I have to ask about headphones because I've got teens. So when we talk about 85 decibels for 8 hours, that's not going to make any difference to them whatsoever.
Right.
So what's a good guide that we can tell, not just teenagers, anybody, because there's a lot of people that use headphones every day for a good chunk of the day.
Absolutely.
How do you know if they're too loud?
I'm glad you asked that. Well, one thing I always encourage people to do is be a good role model. When they see you're wearing headphones at reasonable and responsible approaches, that is a good role model for your children as well. But typically what we say is at an arm's length away, you should be able to hear a conversation going on. So you shouldn't be able to surprise somebody that has their headphones on, especially your children.
And a lot of people do not have them at that level,
No.
do they?
One thing you talked about was the damage to the hair cells inside the cochlea. Can you tell by the audiogram that that's what the problem is? And if so, what about a cochlear implant?
Right. So not just from the audiogram alone. An audiogram is just one piece of the entire puzzle. There's lots of measures that we can do that are outside the audiogram, that are more objective, that are growing in just how we approach our clinical questions. So there are some tools that we can use to tell us specifically that we have outer hair cell function loss or inner hair cell function loss. And those are the tools that we might say, come back, we're going to do some additional testing. The other thing, cochlear implants are of growing popularity, and actually we have a lot of success with our cochlear implant patients too. So depending on the type of hearing loss and degree of hearing loss, so typically more severe hearing or profound hearing loss, cochlear implants are very helpful in those scenarios.
But that's a big deal, isn't it? I mean, it requires a major operation, and there's an appliance on the outside of the ear. How does a cochlear implant work, and how do they put it in?
Sure. A cochlear implant, the purpose of that is it's actually a small electrode that is inserted inside the cochlear into the inner ear itself and electrically stimulates to the auditory nerve. So it bypasses that outer middle sort of inner ear that I was describing before and lets us do direct stimulation. It is an operation. It's usually part of a more extensive evaluation and workup prior to that testing too, or that approach.
In your in your opinion, what is the most exciting research that's going on right now that you think will help people with hearing loss, particularly age-related?
Well, the most exciting research that's really going on right now is how do we access hearing healthcare in general. So much of the population, as you already mentioned, is at risk or has hearing loss, but aren't coming in to either get evaluated or to get treatments. So we have a lot of research, even here at Mayo Clinic, on how do we improve access to hearing healthcare and when is the best time to come in and get a baseline evaluation. Right now, we recommend around age 50. What if it's sooner than that? What if it's later than that? That's something that's really exciting to me.
I know that there are some trials, or have been some trials, to try and find a medication that will help with age-related hearing loss. What's the status there?
Well, right now there still is not a known medication that can prevent or help with age-related hearing loss, but it's certainly an active area of interest for many, because that would be a magic pill would be great for everyone.
Mm-hmm. It'd be a lot better than having to use a hearing aid. What's the number one complaint you hear from patients that you have prescribed a hearing aid?
Mostly the complaint is difficulty hearing in background noise or in large groups. You think about we don't communicate in isolation. We're usually in a group of people, and that's the challenging part. And it doesn't always show up on an audiogram that you have increased difficulty in background noise. So that becomes the biggest complaint and the biggest aim in a lot of our treatment.
How hard is it to learn lip reading?
It's very extremely difficult. We all do a little bit of it throughout our lifetime, but it is quite a skill to be developed.
Well, until the hearing aids get better, I can just still say to Tracy, turn my volume up.
And I do.
That's true. Prevention's still going to be our number one solution. But
Yeah. Dr. Gayla Poling, Director of Diagnostic Audiology at the Mayo Clinic, thanks so much for being with us.
Thank you.